Doctor, are you
Yes,
there?
sir. How can I help you?
Yeah, I have what you'd probably call early stage COPD, and what I mean by that, it doesn't impact me unless I exert myself with some stairs or hurry up to let it try, something like that. But definitely I do have it. That's been established with a pulmonologist. I'm thinking of going to see you concerning the stem cell thing. Now, the thing is, here's a real quick question. I won't go into specifics because that's for you when you talk to your patients, but I spoke to your staff, and I have an idea of approximate cost of a session because I know Blue Cross and all them, they don't cover it.
Right.
It's
deductible from your taxes at the end of the year as a medical expense, number one.
Okay, fine.
Some people that have businesses will either use a business check or a credit card, so you have another deduction there.
But it's
maybe I'm not supposed to say that, but
regardless of that, the issue, the financial issue is not the main point here. I was wondering how many infusions of stem cells are usually involved in the treatment of COPD? One.
Typically one. Let me give you the breakdown on it.
Yeah.
We're bringing you in.
Yeah.
You put on a paper gown. You obviously keep your underwear on. We cleanse the abdomen with betadine and numb up both sides of the abdomen and your skin.
Right.
Then we numb up the fat and suck out about a cup of fat, maybe 60 to 100 cc's, depending upon what we're trying to achieve. You know, some people want to do a joint and the IV. Not oddly enough, but I guess as most people would expect, the IV works on every organ of your body. So people, while they're doing their needs, say, wait a second, well, I'm going to take the fat. I certainly should try to fix my other issues or organs as well. So we then take the fat and put it into a sterile environment in a special hood, a downflow hood. Scientists would know what that is. It's just a big, hood that keeps everything sterile. And we put it into an IV bag. Then we wash the fluid in the IV bag out so it's just pure fat. And then we take an enzyme to break down the fat. We heat it. We shake it up a little bit in the hood. And then we take, which is sort of a slushy, sort of fat, broken down fat mixture, put it into 4 different centrifuge vials that are cone-shaped, spin that at 4,000 RPMs. And as we spin and you're separating everything, when you look at that after the spin, you have oil on top, then yellow fat cells. Then at the bottom, you see the clump of stem cells. You take them out with a pipette, spin it again, and it's ready to inject into the joint or IV.
Approximately how many visits to your office would be involved in this treatment?
Well, it depends, but the easiest way to say it is that let's say we see you on the first visit, take your history, get blood work done, and do the preliminary things we need to have for this clinical trial, which would be blood work and urinalysis, maybe a chest x-ray, or some sort of lung function test that shows us that your lung has significant or some amount of dysfunction. Same thing with arthritis, an x-ray of the shoulder or knee or MRI. So you have to have all that information together. Then typically when people order the kit, that could be either on the first or second visit when we go over the testing. Then we have a visit where we go over everything with the patient, make sure that all documents are perfect and signed. We call that a pre-stem visit. And then, when you order the kit, by the way, you get a date. And then that date you come in, you have your protocol done. You're in the office for about an hour and a half.
Okay. Well, thank you very much.
Yeah, it's a dramatic improvement. In our diabetics, in 2 weeks, we're seeing their blood sugars drop so beautifully, we're getting them back off their medications. In joint patients, as you've heard Enzo and Patricia talk about over the past couple of weeks and month, they're getting relief of joint pain in 2 to 3 weeks and are able to function beautifully. The same with wrist and inflammation and arthritis and back pain. So we have a lot of wonderful results. But again, it's not a miracle. Stem cells are meant to do this. Their only job is to repair and grow and take over and maximize your tissues. So